All right, a great topic we are having today, in conversation with Hillary. Thanks for coming on the podcast today and sharing your story, your mission, your purpose. And I love just helping people get this message out there. So thanks, Hillary.
Yeah, thank you so much.
So tell us a little bit. I always love to ask people, what's your why? What do you do? Why do you do it?
Yeah, I think I had different reasons for my why for a while until my now 10-year-old at 4, when asking kind of what is it that mama does,
Mhm.
she kind of said, Mama teaches people to be happy. And
Love
I was
that.
like, yes, that is like a perfect combination of my why. I'm such a helper and, empath and believe in kind of optimizing high performance. But the true aspect is teaching people how to like lean in and live a fulfilled, happy life.
I really love that. It's so funny. My husband said that this morning. He said something nice to someone, and it's like, gosh, it just made me feel so good. It just to compliment other people to make them feel good. It just you
Hmm.
get that good feeling back. And I think a lot of us don't really know how to be happy.
Hmm. Yeah, I think they think you just wake up, and I'm like, no, you don't wake up on the wrong side of the bed, and you don't wake up happy. Like you have to be intentional about the things you're doing to feel
Mm.
that emotion.
So what would you say? You said high performer. Good
Mhm.
question. I would be wondering, like, what is a high performer to you?
Yeah, I mean, I specialize a lot in athletes. I'm a clinical sports psychologist, so I work
Mhm.
a lot with athletes' mental health, and that is for sure high performers. But in general, I really believe across domains, we're all working as performers and we're all working at our highest potential. And so, if you classify as a high performer because your job relies you and you want to be the best you can, like awesome, you are a high performer, right? It's not just those that are in our elite class at the professional level or the CEO C-suite positions. It's literally truly anyone in an environment that is striving to be their best.
Keep saying that each day. Actually, I did a post this morning, striving to thrive and to move our best, to feel our best, and perform our best in life, not just for sports, just to survive each day. And just having that mindset changes a lot of it,
Yeah,
I would think. So,
absolutely.
what do you feel that you're a clinical sports psychologist? What do you feel there's a need for that area, that niche?
I mean, for me specifically, right? When I started out, I was an athlete myself, and the big push was performance optimization, right? How can we get that competitive mindset? How can we teach these certain secret sauce and mental skills that would be the game changer to push you to the next limit, right? And expand that on the mental side of things. But for me, the evolution of my training and my work and what I was seeing within the field, and my true passion really was mental health and mental illness in athletics. And treating that person within the player. I think oftentimes we see these sport professionals as such superheroes because they are a 1 to 4% human that has the skill level to be at this optimal form of entertainment for us. And they forget the human aspect. And so for me, I was really drawn to treating that human, that emotional component that then would allow them to thrive even more in the field. And so that has become a more public area of interest and more mental health in general has become more pop culture, which has its pros and cons. But for me, it was much more of let me actually treat the entire athlete to help them
Mhm.
succeed.
And I think that's what your story resonated with me is looking at for years in the endurance space and competing in triathlons, Ironmans, ultra running, 50K races, marathons. People always have a story of what drives them. And I always ask people that I know that have been racing for years and don't know when to stop. And it's almost the question I always ask is, what are you running from? Or what are you running to? What are you not resolving? So is that correlate with, you're talking about mental health and trauma with competitive high performers
Yeah,
connection?
I mean, spot on endurance athletes. And look, I was one of them. I was a distance runner in college. Then I did 8 marathons. Now I'm in High Rocks, which is this endurance-based functional fitness movement craze that everyone's on. So
Yeah, keep hearing about that.
I myself can listen into my own advice, but it's the phrase of, are you running towards an emotion or are you running away from an emotion? And a
Mhm.
lot of people are utilizing exercise when they've gone through something significant. Um, to work through them in meaning making, right? To either feel something different or to process and to have quiet space. And so there's pros to the choice to start movement as a healing framework, but as we're aware, it also can be very detrimental if we don't take into other accounts of rest and recovery and actually processing the emotions. So yeah, to your point, like a part of my work very much is in treating trauma and treating mental illness, and then also really treating and helping educate organizational leadership around creating cultures of care to reduce trauma to continue to be reinforced. Because we know sport and high pressure environments really can cause some pretty traumatic things to exist if we don't get the culture right.
What would you define as trauma?
Yeah, I love that because, like I hinted to already, like mental health has become this like pop culture thing, and so is trauma. Like there's big T, little T, and I don't want to discredit the fact that those terms are helping education and get people to talk about stuff. But for me to break down the core component of trauma, it's a physiological response to something that has caused us pain, right?
Mm,
And there's this kind of process that we really categorize and put our traumas on continuums because we never want our trauma to be bigger than someone else's. So we have to minimize. But at the core root of something, you stubbing your toe, you witnessing a car accident, you experiencing a loss is traumatic. There is pain that's caused to us, and we have this physiological response in our brain that results in the amygdala firing and having like, freeze, flight, fight or fawning that exists. And what I get to the root of is okay, that's the first component. That is trauma. Something happened, a stimulus response. Where we get stuck is the meaning of that trauma. And that's the part that
mm,
people start confusing trauma as. And I'm like, well, that's your healing phase. That's your
mm.
harm and healing phase that you're going through. That's caused from the traumatic stimulus that happened to you. But then we have to really define kind of the other components of how we make meaning of what happened to us.
What if people don't always know that they've had a traumatic experience and they don't heal from it, they don't repair, they push past it, then what happens?
Yeah, I mean, half the time we're socialized to just minimize our experiences that we know, or yeah, that was trauma to you. That was a physiological response that happened to you. And prime example, every single human living in the year of 2020 and beyond that experienced COVID, that was a traumatic pandemic, that existed through this
Mhm.
process that we all went through. However, we all made different meanings of that experience, the things that were taken from us, that if we got sick or not, if we lost family members, if we lost jobs, if our livelihood had to change, but we all experienced the same event that occurred worldwide. And so there's a relatability, but the difference between that impact will change and shape all of our socialization, the behaviors, the way we live our life since that one event. And to your point, if you don't make meaning and have self awareness around it, it could change the trajectory of your social relationships, your own coping responses, how you manifest stress in your body, which could be very detrimental in the negative way. Or it could be a very protective factor and protects you from future harm that could exist naturally by you just kind of learning how to cope in the world differently.
Hmm. So I wrote down, there's a lot of words there. Shape behavior, self-awareness, manifest stress, and protect
Yeah.
self, basically. But working north, talk about how we respond to stress. You mentioned amygdala, and I hear that a lot in the stress response. And someone who I struggled with, I don't know what the word is anymore, but adrenal exhaustion, but that's not what we're supposed to call it. But HP axis dysfunction is a mouthful, or
Right.
metabolic chaos. So when we feel stressed or we have a stressful experience, how we
Mhm.
perceive it can vary per person, I would
Yeah.
think, and
Yeah.
genetically response. But talk about kind of the order of operations on. I went through March
Yeah.
2020.
Right. Yeah. Like you have an immediate like amygdala cortisol chemical reaction right in your brain, right? And when we experience these events, we only process the emotion for 90 seconds. It's like wild, right? The
Mm,
actual chemical release in our brain. However, your mind will keep running loops on the neural pathway that causes you to keep remembering them and keep feeling different things because we keep thinking about it. And so the first reaction is like if an event occurs and the amygdala, I like to call her Amy, right? She kind of goes crazy or not. Like she has a lot of reaction and she's like, really like, hey, freak out, danger zone. And your brain's like sending all these firing neurons to yourself and like protective factors and cortisol rushing through your body and dopamine and all these levels that are saying, hey, do we need to attack this, right? And protect ourselves? Do we need to freeze? And like, we're not sure. And then we know if we're in that freezing state, the neural firing to our frontal lobe, which is our processing, the way we have like decision making, that's going to be impaired, right? And then we have tension and cortisol, like I said, rushing through our body. And that can lead to different areas of maybe you have upset stomachs or just tense back or lead to illness, right? The things that people don't realize, the stress response in our body, we carry so much stress. And some people have a somatic reaction to it, headaches, fatigue, stomach aches, illnesses that allow them to be more susceptible to it. And so there's a variety of different chemical reactions that occur. And when they continuously reoccur, it's because we keep thinking about the event. We keep ruminating over them and perseverating. So, like, our brains are wired in a terrible way to identify negative things and trap that negative emotion because we have more primary negative emotions than positive ones. And so we stick into this what if trap, this anxiety is firing, and the worried and the nervous system is overactivated. And that's where we have to learn how to regulate it so we can think more clearly. Because when you're in such a state of stress and high alert and anxiety, it's very hard to think clearly.
Okay, so I like to go deeper.
Yeah.
So Amy, just to follow, Amy, the amygdala responds, senses stress, and that interprets it. And then talk us more in depth. The hypothalamus gets a signal from Amy, and the pituitary gland sends a signal to the adrenal gland, and then we
Yeah.
respond. Kind of walk us through a little deeper level of
Yeah, I
the
mean,
response.
I'm not deep into all of that medical makeup for sure, but all of those things,
Yeah.
I think where I hit mostly is that amygdala reaction into the hippocampus, which is very essential too, which is like our memory
Mhm.
making. And so I kind of
Mhm.
call that the hippo, right? Does the hippo go to college
Yeah.
to remember? And when Amy's a little bit hot and crazy, we're gonna have a hard time remembering. And this is why when traumatic things exist, our memory of the event can be skewed because we don't
Mhm.
have the right neural firing and the processing that's existing to help you make meaning of the event correctly. And then so until you learn how to calm down those coping mechanisms and get back to that prefrontal cortex where we have more emotional regulation, decision making, executive functioning, then we can have better firing neural pathways of how do we recall and remember events specifically.
Mhm. So the frontal cortex is involved in coping mechanisms. And then you talked about the chemical reactions and the negative wiring from that reaction. So it's more you're saying the response to our stress can vary per person,
Yeah.
how we kind of get a recording tape of that experience, and it just doesn't stop
Yeah.
unless we do something
Yeah, like I mean, all
different.
of our emotional regulation, right, is like in our prefrontal area as well, right in the front
Mm,
of our brain, just like the decision executive functioning. And so, if you think about this, if you're already someone who's predisposed to ADHD, anxiety, depression, that part of your brain already knows has that active kind of wire crossing that's like, hey, it's either hard for me to focus, I'm impulsive, or I'm highly anxious, right? Those neural
mm,
pathways, when triggering events happen, will stimulate those responses as well. And so, to your point, we have to stop the neural firing in a certain way and like calm down, right? So you have to then bring in the hypothalamus and we have to bring in like all of the, lower part of our brain where it's like, hey, how do I breathe? The oxygen part
mm,
to regulate my emotions. And so breathing is the best essential tool because when you breathe, it allows the parasympathetic system to come into play. And then breathing and counting puts you on a different neural pathway because we can't
mm,
actually think about two things at one time. Like a
mm,
small super percentage of humans can actually set shift enough to think two things at the same time. These multitaskers are not really multitaskers. So if you breathe and count, now you've programmed your brain to get onto a different neural pathway. And I like to say it's like exiting the roadway. And
mm,
now it allows you to say, okay, what road do I need to get on? That allows me to think more clearly and be more in control and assess the situation differently. And so those that are more equipped to take a minute, breathe, pause, ground themselves in the environment will then have better coping reactions and get to better decision making processes.
mm. So going back to how's the nervous system mentioned, we've got parasympathetic, rest, digest, recover, repair, and then sympathetic, fight or flight. and freeze, I hear a lot is added in there.
Yeah.
So how's we kind of get shifted to responding to a traumatic, stressful event. We get into sympathetic fight or flight to react to that response.
Yeah, so first we have the sympathetic system that's totally activated, right? Like in an
Hmm.
event occurs, sympathetic system's activated. And for me, I'm saying, hey, when you breathe and when you regulate that parasympathetic system, what I like to say are paramedics, right, for our body, the emergency system can come into support and play and help you calm down faster and help you heal and take care of you. And so I'm always kind of trying to get people to do preventative care first and learn how to regulate their breathing every day in non-stressful situations and to utilize grounding techniques and mindfulness because that's building this, parasympathetic emotional response system at play and helps what I kind of call our emotional hygiene. So when events occur, we can immediately this activate the parasympathetic system quickly and hopefully respond faster and heal better.
Do you study the role of the vagus nerve involved in all this connection?
I have colleagues that definitely do and help me and make me feel way smarter on that area for sure. When looking at the deeper, biomechanics and neurofeedback that goes on.
Hmm. Yeah. And what about genetics? Do you find any correlation with genetics that change how we respond to
Yeah,
stressors?
the interesting part about genetics, one is like nature nurture kind of rule, right? And knowing that you are predisposed with certain genetic components already. And so some people could be living their life beautifully and happy and functioning really well. And then all of a sudden a significant event occurs in their life and it might activate a gene that says like, oh, hey, you're predisposed to anxiety. You didn't know this because you had a lot of nurture and learn environments in your life that were really good and set you up to be safe. And now something significant occurred and it activates that gene and causes, now you to have more, susceptibility to anxiety and anxiety stressors that you have to work through that hopefully are only state like and not trait like. But we know some of the genetic components can be activated because they've been in our genocode system.
Mm-hmm. And so I always wonder why, I mean, myself, why did I have more chronic stress issues than other people could do the same schedule, the same competitive sports and be fine. But my beaker of stress was easier to overfill and cause me to
Yeah.
be in fight or flight than someone else is like totally fine.
I know. And it's like, man, how do you live your life so chill? And it's like, oh, you
Yeah.
just didn't have that activation that like allowed you to have anxiety.
So how does this correlate with your work in with athletes and what high performers, athletes, or just competitive people? What do you find the connection to all this
Yeah, I
together?
mean, so we're all humans, so we all experience the same kind of emotional components
Hmm.
universally. And for me, it's much where I kind of say I work with the head and the heart, and so I work with how their athletes are thinking, and I work with how the athletes are feeling. And a lot of the work what I'm doing specifically is either understanding do they need help on their field and their performance domains and learning more competitive mental skills training and pre-performance routines and things that will help them thrive in that competitive environment and then recovery back down and integrating a lot of the exercise science kind of physical activations together and knowing how the body connects to the workload they're doing. Other athletes I have that come in are there because they experience depression, anxiety, are recovering from a traumatic event, trying to make meaning of their life, transition into parenthood, with certain athletes I'm working through. And that's a different dynamic of choosing to be a parent when you also are choosing a work that allows you, that forces you to be away from your family because of the travel schedule and the workload. And so working through kind of those identity shifts in the human aspect. And so then all my work might be just on them building up their coping skills and working through their process and making meaning of their life and the roles they play, knowing that they still have their job to do, which is a sport.
So, what do you find are some solutions for people? But first of all, like working before that, how do people know if they have issues? What are some signs and symptoms that they need help? And then let's look at solutions.
Yeah, I mean, I think for any of us, when you notice that the core pattern of your behaviors, like are impeding your social relationships, personal relationships, your emotional hygiene, right? Are you now not taking care of your daily living needs, right? Your eating habits change, your sleep habits change, your physical energy for working out or mood in general is changing, right? So if we start to notice certain patterns of our areas of ourself and then how we interact with other people and our concentration levels and our work production might be failing, then we know, hey, something might be going on. Maybe it's a temporary situation that we have to work through, or this is long-term stuff that's impeding in other areas and it's boiled over, as you said, because we all kind of have levels and cups. And now it's like, hey, this is
Mhm.
really impeding my area of functioning and I'm really having a hard time. We're still such a reactionary intervention based component and environment to utilize mental health support, where I really try to encourage and educate a preventative approach and say, hey, like, you know that you're in these high stressor situations in general as a elite high school athlete with high pressure of school and sport and schedules and identity formation as a teenager. Like, let's get you in, and there might be no problem at all. Like, you might be excelling, and my job is, can I keep you on maintenance mode and check in every now and again to build up these really good skills that you can utilize, because when stress arises, you now have a toolbox that you can go to and you can reduce the impact of whatever the environmental cause was and continue on your path of being successful. So I'm really trying to work a lot preventative and not just intervention based as well.
I think a lot of it is how you perceive it. So you're kind of rewiring the body mind connection to how, when these things happen, how to respond to them, and having tools in the toolbox, what to pull out
Yeah.
for this experience or that experience. So they just know, oh, I know to pull out this breathing exercise out of my toolbox. And that I know from experience that will help me reset and
Yeah.
recalibrate.
And I'm going to use my breathing before any stress response happens because I know that gets me in a better thinking space, right? So I'm going to
Mhm.
breathe before I go into play and get myself in a calm place, because I know when I enter into this playing field domain, it's high processing, high fast pace, high decision making, and I have to utilize all the things that interact. And then to your point, okay, when do I reset? How do I reset quickly? How do I get these cues to help them kind of stay in the process and moment of what they're doing?
Why, why do you feel that the breath is so powerful in changing their mindset?
Because it's an immediate pause and different neural pathway, right? It's an immediate physical thing you can do, and the benefits are essential, and it doesn't take long to do anything. We don't need any equipment. We don't have to do anything. We naturally breathe all the time, but intentional breath work is very different and actually
Mhm.
allows to activate all the parasympathetic systems that we talked about. So essential for our well-being.
So is it just doing specific breath work? And we'll go into what that looks like. Is it just shifting us to the parasympathetic nervous system and getting us to calm down and getting it because we're getting out of that fight or flight?
Yeah, it absolutely gets you to calm down and think faster and clearer. And once we know that we are calmed down, then we know we can get into that cognitive function, which is our creativity, our confidence, our proper decision making we want to have, and that high conscious cognitive functioning is essential when you're going into these environments. So once you're calm, then you activate that frontal lobe way faster.
Hmm. So it's what type of breath work do you find works best for a lot of people that they could experiment with?
Yeah, I mean, this the simple approach. There's so many that you're going to find out there, right? And so, for me, I just first start with like what I call triple threat breathing, where it's breathing in for 3 seconds and then holding for 3 seconds and then exhaling for 3 seconds. Similarly enough, like to box breathing, there's different patterns of 4, 6, 8, and then there's like chimney breathing. For me, it's not so much about the rhythm, but what I'm trying to teach them is, when you inhale, you take what that cadence is for you and you count, because like I said, it allows you to get on a different neural pathway and get you connected to the task. And then the tension part is really essential for my teaching of holding that tension, holding that breath, because it's training your body of how can I hold tension when tension exists, and then release that and exhale that through and realize the release I can have to then take another breath in, which is like, hey, calm back down. So I'm training the body of like how to get into a state of stress and then how the body can respond to allow them to be calmer and faster. And then usually once we work through this, everyone kind of finds their ideal rhythm, their ideal breath work that works best for them, and how quickly they need to utilize it. And so that's why I told you originally, I like to encourage in non-stressful times. When you first wake up in the morning, can you do these breath cycles for 3 to 5 minutes? I call it the 5 minute mind. If you do 5 minutes a day, at least, every day you're going to get the parameter that we know will lead to proper neural pathways and cognitive function that helps you actually calm down the amygdala faster. And so
Mhm.
there's simple cues of like taking cognitive resets and 5 minute breaks a day as well. It allows the cognitive function to work better. So the brain is so powerful if we train it. And the thing that I say most essential before we do any thought changing or other behavioral tools is breath work. And slowing down and taking 5-minute breaks will actually help your brain heal faster and work better for you.
Is it similar to what you're talking about as well, to neuroplasticity and creating
Yeah.
new neural
Yeah,
pathways?
exactly, right. And so, I just recently went to this learning summit, this high performance summit, and they were talking about cognitive enhancement in high stressful environments. And we used to think like, okay, your brain develops until you're 25 years old. Beautiful, cool. Now you have all the working function of your brain, and then at 30, it's like, oh, your brain now is going to die and slowly like not do well. And I'm like, man, you got 5 good years. Like that's terrible to think about. But what now we've learned is if you start doing these cognitive training and habits, you are instilling more growth in your brain. You're instilling the neuron pathways and the firings to exist and, allowing it to continue to grow and utilize at high levels versus shrinking and losing these neural pathways and connections of how we used to live. So I'm trying to teach people early on, like breathe, do cognitive training, utilize the brain to have it work best for you as you have longevity in life and your sport. Because we know our athletes are learning how to perform longer. And so we want their brain to be healthy as well with that.
Now, how do you measure if this is helping? How do you know if you're making a shift?
Yeah, I mean, that's the beautiful art of psychology and how does this work and especially with mental health and mental performance training. A lot of it is still subjective, right? We do have some measures and questionnaires that we can utilize, which again is also still subjective with paper, pencil, and the person taking it. We can add in some wearables if you look at sleep and other factors that go into health and you start working holistically with sports science teams. Um, but for me, like my biggest indicator is like my self report. I'm not the person I'm working with. And so the person, if they're saying they feel good in their body and they're performing well and they can say, like, yes, we're winning games or I'm performing my best with my numbers and my metrics and I feel really good, I'm going to trust like is working. Like we're going to know. Of course, I'm going to mark like what interventions we utilize and it's evidence based that we know these things have been shown. Um, but it's really hard, right, to actually measure and have it be significant and valid and, transferable.
Hmm. Well, I know a lot of athletes are using a Whoop
Yeah.
and Aura Ring and
Hmm.
their Garmin and all these devices tracking heart rate variability as well as sleep scores, which I don't find any of them are 100% accurate because they're on your wrist, they're not attached to your brain. And wearing a heart rate monitor chest strap, we can measure heart rate variability in real time, not by a red light ring or a watch. So,
Hmm. Hmm.
would you find in your space you're looking at heart rate variability, low frequency and high frequency measurement to balance the nervous system as a biofeedback?
Yeah. So, in my private practice, it's very different than when I've been integrated in organizations that have sports science teams where we look at this data. Um, to me, I've always said, hey, it's just one data marker. So when my athletes come in and they're like, hey, my Whoop score is this, or my recovery score on Aura is this, or my sleeps that I did this, I'm like, don't wear it the night before you perform if you're relying on that score to
Hmm.
tell you if you can go perform or not, right?
Yeah.
So part of me is also training them that everything we look at from a number is our own biased perspective of what that means and what we're making meaning of because we haven't not everyone's trained in the science behind what all these numbers and charts mean as well and I kind of say, hey, let's look at the trend. Let's look at our lifestyle. Let's look through what
Yeah.
we're doing. What does that mean to you? It can be very effective to understand that. We do know sleep and nutrition are the first two components I will ever ask my athletes to work on if they need to improve their mood, right? That's
Mm.
science behind those things. However, I'm also going to understand that every sleep environment's different, what we've had in our body intake and all those workloads and all that will change how we sleep and our numbers on top of that. And so I have to help my athletes know the score is not going to be the result. You will not feel your best every day you go show up to play. And so if you're relying on being your best to play, good luck, right? The likelihood of us being 100% is very minimal. And so we can live our life doing all the things that we feel are going to get our the best sleep, the best nutrition, the best recovery. But we also just know that it's not realistic that every day is going to be the same. And so
Mhm.
all this information is beautiful and it's helpful and it helps us understand the body. But everyone's body, again, like we know, is very different in composition, ethnicity, gender, things that come into play. So take the data, understand what it means to you, and look at trends more so than one number to define all things.
No, I agree. And I think I found over the years, wore an Aura ring, but I feel that the lot of people don't know what the data means and how to use it, or they don't use it. And they also use it too much. On the other
Yes.
end, as you're saying, that they'll have a poor performance mindset, everything changes because they had negative scores or a drop in their scores. And so it's interesting to observe over the years since these devices have been trending
Yep.
that we forget, as you said earlier, how do I feel?
Yeah.
Checking in with myself. Did I wake up feel good? I'm happy. But then I find that people like, oh I sync my device and I get my score and it was bad. All right, I'm gonna have a bad workout, that we have to always go back to
Yeah.
intuition and checking
Yeah,
in with
a
ourselves,
hundred
being
percent.
mindful.
Like, I think there's beautiful things with the evolution of science that we're getting at, and AI is changing the creation of a ton of access to what we can learn about. However, you are your best measure of how you're feeling, and intuition is very essential. So you do have to know that you have power of your mind and your body to know, like, how can I work through this, and actually know I'm okay.
Yeah, I think we always have to combine the two together. It's great
Yeah,
information, but you have to always go back to, but you know what? I feel pretty good.
yeah,
I'm not going
right.
to let that number ruin my day. So I
Yeah.
appreciate that. Now, you focus on athletes and mental performance or mental health. Why, how did you come here to the
Yeah, I
connection?
was a youth athlete myself, very competitive, started at the age of 4, multi-sport, and moved in different places. And where one area had a lot of resources, lots of clubs, lots of high access to really positive training. And then moved to an environment where I didn't have all those resources, but still could participate. And then I was just winning really easy. And I was like, this is boring, which sounds silly, but like I was at a part of, I was 14, identity teen kind of formation. I started feeling like, oh my gosh, everyone's going to expect me to win. Like, I used to have to fight
Mm,
for it, and still really do well, but it felt different when you were fighting for something versus like no one's pushing you. And
hmm
at the time I was not an intrinsically driven athlete. I knew my drive was extrinsically playing and performing for other people. And so it was a real juxtaposition that I was at in my own identity, and then the pressure, and then kind of just losing the motivation. And so I was like, I really wish I had someone to talk to. And funny thing is, my mom is a counselor. She had access to a lot of mental health support, but I battled her when I was 14. Like, I don't need to go to see a psychologist. I don't need to see a counselor. Like, I need someone who gets this competitive mind of mine. It's very different in my bias field. 14 is what I felt. So I was like, I will be that for my athletes. So I knew at 14 I was going to be a sports psychologist. I was going to be a therapist for athletes. And went on to school and was a collegiate athlete and started studying and training. And then I fell in love also with mental health and how there's this crossover of movement and exercise as interventions to reduce mental illness. And I dove into different populations of the at risk, and what we look at, like our ADHD, our behavioral cognitive disorders, that these kids didn't have the structure and were having behavioral problems. I was like, sport could be a beautiful mechanism for them, right? But no one wants to put them on their team because they're like, quote unquote, labeled the bad kids. And so I was like, really found this beautiful blend of how could I use sport as a positive experience for kids, because it was so beautiful for me, and allow them to be successful, know that we can have places to build life skills, but then also treat the athletes that are already lucky enough and privileged enough to be in these sport environments, and not forget about them, because oftentimes we did and just felt like they were these superheroes that could do all things and forgot that they were humans. And so I kind of had this beautiful blend of both aspects, and led on to my education and my pathway, and then into building my private practice and getting to work with a lot of different athletes and organizations in different realms of my interest in this field.
I think you said something in the beginning of that, like identity. And I feel that as we spoke earlier about what are a lot of athletes running to, running from when they're always racing. And I
Hmm.
wrote a book, Life is Not a Race, It Is a Journey, about my own struggles and what I had happened to me. But as I've had this podcast for uh, over 12 years now, and it's so many, when we speak towards the community of endurance athletes, competitive individuals, high performers, when they can't stop racing. So find we have an identity that
Hmm.
before I had my adrenal exhaustion, every day, every day, someone would ask me, when is your next race? And that gave me self-esteem in a way. I didn't ever
Yeah.
feel I was good at anything until I got into endurance sports, specifically triathlons. I did well at them. It came easy to me to do endurance work. I'm not a great swimmer, but I could do well on the bike and stay ahead on the bike and or on the run. And I find that I had to shut everything down because my body couldn't do anything more at a cellular level. It's just too hard. But as I shared my experience, so many other athletes, I think they struggle when to retire and
Mhm.
stop racing. And I even now that I live in San Diego, there's a lot of people that I'm like, oh, I don't know how to stop.
Yeah.
And do you find that as so many people have that identity with that, like, oh, they do, like I know someone I talked to, the ultra races, or they do this, they don't know when to stop. And because they lose that identity, that's what I'm known for.
Yeah, I mean, I'm a walking example of this. And it's interesting, right? So I was a collegiate athlete, and then I transitioned. I did really well in undergrad, but I had one season of eligibility left. So I was a cross country, indoor, and outdoor track runner, and I had outdoor track season left to run. And I had my best outdoor track season my senior year of undergrad. I was a conference medalist, like so
Mm,
good. But I knew I still had this one level left, and so I was going to a different Division 1 program for my master's, and I asked the coach, like, hey, do you need a steeplechaser? Like, here's my numbers. He was like, yes. So then I'm like on this high, like I can continue on one more year. And that was a really bad decision looking back at it. I ended up, the training load's different. And so I went from a high endurance training, low impact, like sprint impact
mm,
program to a very intense impact, and while trying to maintain my mileage. And so ended up actually having like my sesamoids were crumbled in my left foot. And I was running and training with my sesamoids crumbled all fall just to compete in the spring. It was wild. Like I'm like wearing a boot in the day, then I'd go run and then I put the boot back on. I'd get cortisone shots, all the things that I know are very unhealthy for athletes, while I'm studying to be a sports psychologist, because I couldn't give it up, right? I wanted to compete and
yeah.
I competed and I still did really well. And then I had surgery 2 days after my last conference race, which was crazy. Um, and then I
Typical.
did all the things as well, of running a marathon before each kid turned one, that I thought it was a rite of passage. All the moms out there, do not do that. That is terrible recovery for your body. Like I had C-sections too. I should not have been running a marathon within 1 year of my healing process. But I didn't know how to not do those things because, as you said, for me personally, like my identity was wrapped around sport, high achievement, high functioning. Like this is where I got my serotonin and dopamines, what made me feel good, and then also wanting to prove to people like, look how cool this was, and then these like, extrinsic evaluations and praise, and so that's my personal journey. And I think what actually saved me from doing that is when I was like, you're having children, you actually can't run, like the time of taking time off. My athletes that are retiring, they have the hardest time within that first 1 to 2 years of retiring out of their sport. If you have a healthy retirement and it's your choice, which rarely ever is, but if it is your choice, you have a much softer landing period. But those that have career ending injuries or get traded or just age out and, it's like time to go, they lose sponsorship. It's very hard for these athletes because they're used to their world being structured, scheduled, everything given to them, competing, doing all these things, and then they're left with like, what do I do? How do I do these things? Who am I? And so that's where a lot of my work has strove to say, let me help you be the person you are, beyond just the player. But I can't deny the fact that that will always be their identity. It will always show up for them. It is a component of them. And so how do we build up other areas so they can feel just as fulfilled as they did as that athlete?
Mm. I think I find that probably struggle too for a lot of collegiate athletes, as I thought of when you're speaking. Friends, kids that I know, one's senior year, Ohio State top softball player, female
Yeah.
team.
Yeah.
And what, and I know someone that did volleyball, and then I know someone that just graduated last year from top Ivy League school, top and swimmer. And it's not that, very few people compete after college into, especially female sports, go
Right.
pro.
Right.
And I know some of them go to Europe, play
Hmm.
volleyball, and then I know this gal's going to do softball in Europe. So it's like, how do you get out of that? And not, I'm sure, I just think there's so much mental health issues struggling to get that transition from, all right, I've been this top athlete since I was a kid, as you probably can relate to, all right, now I'm going to work at New York Stock Exchange or business or whatever their business job is that so hard transition, I'm sure, for most people.
Well, and what you notice is all these elite athletes are pre-wired to be high achievers. They're
Mm.
pre-wired to have this discipline, this dedication, this drive. The majority of them are like, this is like where they are. So they will find a niche to optimally still try to go be the best in whatever they're doing, right? This is why we have Fortune 500 companies recruiting college athletes
I'm
because
just
we
going to say
know,
that.
we
Yeah, people,
know
you put that on your resume.
right? Like they've been deemed that they were an elite athlete. They competed in high pressure situations at a high level. So
Mm,
it's kind of a misconception. It's a bias, but they're assuming that they
mm,
have these traits and these skills to be dedicated, determined, focused, intentional, handling pressure.
mm,
Now, we know sport can do that, majority can, but there is still some anomalies that not every athlete
mm,
has that drive. They just happen to be really great and talented. So I think it's a healthy transition if we can provide more preventative care, like I talked about earlier on how do we transition out, how do we build up these other skills.
mm.
It's a unique field in the college space with NIL because there's some real pros that you can have if you have NIL deals because you get to learn different skill sets and you get to
What's
learn about
that? And
business.
I,
It's the national image and likeness, that
mm,
where college sports are paying their athletes certain money based on sponsorship now. And so, it's a huge trend, obviously very beneficial for Power Five schools and schools that can get more lucrative deals based on where their locations are and revenue branding and differences in male and female athletes. But we see a lot of these athletes now learning how to work in marketing and branding because they're partnering with these deals and they're learning how to
mm,
make money. And so there are some cool positive benefits of the collegiate space in that realm that shifts you from just doing the sport, but still has an intrinsic vibe of money associated for their
yeah.
performance. So it can also be more pressure. But the college sports space is very interesting now with what's happening politically with their domain.
Hmm. So how do you help people? What are you doing? I know you wrote a book. Let's talk about solutions and how people can
Yeah.
get help and guidance.
Yeah, I think the first part is understanding that like utilizing someone for support on the mental and emotional game is not because you have problems, not because you're not capable. It's actually just another resource and another coach in your environment that allows you to be successful, right? So that's the first step is go get with a coach and learn how to work with a mental performance coach or a sports psychologist who can help you on these areas. And yeah, maybe the spin is going to help you perform better, but through those conversations and dialogues, you're going to learn a lot of skills that are very essential for your mental well-being and your mental health. Yes, my book is another component. So I have big education. I have a podcast out called Highs and Lows of X's and O's, which really stems from the story shares of elite performers and what they went through. So people can be like, oh, I connect to that person. And then we get to give a little cheat code to help you, which is a free resource. If you've never learned anything about sports psych, you get to kind of understand like, oh, how could I use this tool and how can I work through that? So there's a lot of education out there.
Mm,
And then my book is called Hello Trauma, Our Invisible Teammate. And I wrote this very essential for giving words to people who didn't know how to express themselves and make meaning of things that they went through and allowing them to feel seen and heard and make meaning of what trauma is, how psychologically they went through that. Very similar to if grief and loss has stages, this is the stages of what a victim would go through. If you've never experienced trauma, which
mhm.
70% of US Americans report they have, but the 30% who maybe haven't, at least if you read this, you will now be able to relate better to someone in your life because you'll find someone in your life who has experienced it. So it'll help you understand empathetically what's going on. And the second half of that book is really a call to action using sport as a microcosm of society that reinforces trauma to exist. And it kind of tells organizational leaderships and leaders on how do I be better? How do I show up? How do I create an environment that is psychologically safe and secure? And how can I handle situations in an effective way with empathetic engagement and accountable action to not cause more harm to people that have gone through something?
I would think a lot of people, well, you have to get to a point that you want help and understand that you have to put yourself out there. Like me as a FDN practitioner, nutritional therapy practitioner, people have to come when they're ready to do the work, right? Because we have to, it doesn't come in a pill. So when people come to you, are they
Mhm.
motivated to do all this? Because it's not a pill, right? You have to
Yeah,
actually do breath work. You can't just take this prescription drug and say, hey, you're going to be mentally healthy now and thrive.
yeah.
So What can you do?
It's funny because yes, absolutely stage of change is theoretical stage of change and where you're at. And if you're all in, you're gonna probably work through the process a lot faster. However, um, because sport is so fun and exciting and sexy and entertaining, I have a little bit of an advantage from my parents who are like, hey, we can get them into a therapist, but it's a sport focus. And so they're going to be more opt to coming in. So
Uh,
sometimes I get some adolescents um, who are like, my mom made me go see
you're
this
not seeing a
therapist.
therapist.
Yeah, you're not
Yeah.
seeing a therapist, you're seeing a sports psychologist. Now, granted, it's up to me to make sure I establish a relationship and talk through them and have it be effective. But there is a unique perspective that sometimes people don't want to go to traditional therapists, even though I am a licensed psychologist, trained as a clinical psychologist in all the
Mm,
disciplines. I am a sports psychologist. That's my focus, and I focus on executive coaching. And so I'll have a lot of CEOs and executives come in wanting to improve their performance as one domain, but then we end up talking about relationships and emotional dynamics and their own kind of coping skills and life because we get to work on a continuum of care. So um, yeah, it's a mixed review of who's really excited and who's not, and who's ready. But yes, to your point, in a private practice setting, for sure, a lot of people are like interested at a level of, you know, I want to go get help or I want to perform better. Sometimes I'm the last resort. They're like, I've tried everything
yeah,
else. Like I
exactly.
feel exhausted. Can I just try
Hmm.
you? And I'm like,
Hmm.
cool, let's do it.
Hmm. Yeah. Do you find you ever have to collaborate with other doctors, experts, practitioners to help them with gut health and nutrition, sleep, and stress and those
Yes.
areas?
Absolutely. Like I've had the benefit of working in organizations that had all these integrated high performance
Right.
teams. And then when I'm not in there, because I've always been also a private practice owner and I have six other sports psych and mental performance coaches that work with me, we're very intentional that we've developed all of our own, like kind of like high performance teams where I have physical therapists, chiropractors, dietitians, nutritionists, sleep
Love that.
experts,
Mhm.
orthopedic surgeons. Like we all try to connect. We refer to each other. Like I go out for like lunch and learns or coffee, and we're very intentional in this community space because we aren't a team together. And so we kind
Mhm.
of I love aligning with other practitioners that say, hey, we all can work together and here's my specialty, but you'd benefit from this person also.
Yeah.
And so I'm constantly trying to learn and connect and find ways to make sure I'm up to date on the best process and then also have a resource because sometimes my athletes are like, hey, I think I need this. Do you know anybody? And I'm like, yeah, here's three great references. Here's who I'd
Yeah.
recommend. Go find them in the area.
I get that the other side of it being a practitioner, people struggling with gut health and
Mhm.
eating issues or inflammation in their body or all these different symptoms, but it's also connected when we dive into coaching sessions.
Yeah.
Something trauma, mental health is a big part of it. And then those go back to the conversation of endurance athletes that say have done adventure racing for the whole life and that's their identity. And how does that connect together? And that's why I think it's
Yeah.
powerful to have that integrative, collaborative approach to helping
Yeah.
people thrive as they age.
It's beautiful. And I wish that, my vision is eventually to have this big center, right, where we have everyone
Mhm.
connected. Because I see the beautiful of how everything works together, and
Mhm.
the more I can connect with like-minded individuals and see that and understand, like, I'm not taking you away from that doctor. You'll need them for a reason too. But
Yeah.
here's what my area is, and here's how we can help you be better, and the time
Hmm.
frame of how we work through that.
And I think that's important, which are not putting traditional doctors down, but they're not traditionally there's not an integrated approach. And so like if you go see a doctor, it's for heart or it's for kidney or for, whatever knee injury, or there's not a whole integrated approach. I think with
Yeah.
mental health and sports psychology, working with athletes as I do, like fit and healthy from the inside out at a cellular level, you have to take that
Hmm.
integrated approach. That's great that you guys
Yeah.
are working
Yeah.
on that. So, where can people learn more about your podcast and your
Yeah.
book? Tell us the details.
Yes, so the book is on Amazon, Barnes and Noble, and Audible. I get to narrate it, so that's really fun.
Yay.
And yeah, if you definitely get the book, please leave a review. It's so helpful for us self-published authors. Like, so
Yes,
just a little
no,
self-shameless plug, but please,
you got to
yeah,
do it.
the book's called Hello Trauma, Our Invisible Teammate. I'm also very active on LinkedIn and Instagram. Dr. C Mindset's
Mhm.
my handle. And then, yeah, our podcast, Highs and Lows of X's and O's, is on um, Apple, and then it's also a YouTube channel called Controlled Chaos Network. So
Ooh, I
we
like
got,
that.
yeah, we got some other fun things on there. So yeah, very active. Love to connect. Love to help connect other resources if I'm not your one. As I said, I'm very much a holistic, integrative approach for people in this space.
Yeah, so good. Well, I'm happy that you are following your mission. We all have personal connection to what we do, our why, and it's great that you're giving back and helping people be happy
Yeah,
and
thank,
enjoy life to the fullest. Thank you.
thanks.